Can you hear me? Let's start our program. Okay. Today, our guest is Dr. Rohith Sharma, DHMS. He's from Baba Farid University of Health Sciences, studied the Health Code, Patiala, Punjab, India. Others colony, Badaun Road, Patiala, Punjab, India. He's trying to solve veterinary cases with the help of repertorization, working on finding mild rubrics in animals and prescribing remedies on basis of homeopathy repertory. He has some veterinary cases where repertorization to solve clinical cases. He has an experience of 19 years. Today's his subject is some of my veterinary cases treated with homeopathy. We know that have human being having on anatomy, on physiology, but while handling with veterinary cases, we have to learn every species has its own way. So, sir, Rohith Sharma, sir, you can start now, sir. You can start now. Next 45 minutes for your discussion part.
I'm audible?
Okay? Yeah, you are audible, sir.
Done speaking. Hello.
Hello.
Am I audible?
Yeah, you are audible, sir. You can start now. Yeah.
Your mic is unmuted.
It is not muted. You can start now, sir. It is unmuted. You can talk now.
Am I audible, sir?
Yes, you're audible.
Should we start?
Yeah. You can screen share also, because you are now co-host.
Okay, good evening to all of you. This is Dr. Rohith Sharma from Patiala, Punjab, India. I welcome you all on the digital worldwide platform for promoting homeopathy. I sincerely thanks to International Forum for promoting homeopathy, which is helping all of us to share our experiences of homeopathy on such a good platform. So before I start with the first case, I would like to share my first experience where I found the role of homeopathy too good. It was 2003. It was 2003 when I first felt the power of homeopathy in a veterinary case. So I had a female dog at my home who got warts all over her body. She was not even able to eat and drink as the warts were all over the body, including her eyes and mouth. I took her to the veterinary hospital where they refused to treat her and asked me to go to some homeopath. At that time, I was the final year student, and suddenly it came to my mind that why not I? So I went home, and at that time, the very few medicines were known to me as I was a student. So I took the Thuja 1M, Thuja occidentalis 1M, one drop to her mouth. To my surprise, on the very next day, she started eating and drinking the water. So this was the first sign that the medicine was working. On the very next day, the warts started shutting down, and in 4 days she was recovered 101%, 100% recovered. So it was my first case where I felt that I have done something good. Homeopathy has done something good, and uh, the value of the system of homeopathic medicine I felt first time in 2003. So now it was my first experience. Now I will proceed with the first clinical case where I reporterized the case, and I tried that I should prescribe the remedy to that cow, including the mind symptom if I will be able to get those symptoms. So now I would like to share my first case. So this is my first case, and now I'm sharing the. Now coming to the case of cow, where complaint was when she eats more grass, she suffer from diarrhea. So on asking the history, the owner told that she has lost her child 2 years back. Since then, she is having that problem. On inquiring more about her nature, they told that she is very affectionate, very mild, and she drinks large quantity of water, even drinks more than her capacity, and take from the fellow cow's bucket. In this case, I had taken the rubrics, and I'm sharing those rubrics with all of you. The first rubric which I had taken at that time was ailments from death of loved one of a child, because she had lost her child 2 years back. So I had taken that rubric. The second rubric which I had taken at that time was stomach, thirst for large quantities of water. Third was from rectum, diarrhea, eating after aggravation. And the fourth one was rectum, diarrhea, grass after eating. I have taken these 4 essential rubrics which I found useful for repertorization. After repertorization, I was surprised to see that lycopodium was the medicine which was coming on the top, and the second medicine was nettermew. So here I will share the repertorial chart.
Doctor, do you have any difficulty in sharing?
Sir, not I'm not facing any difficulty. It's good.
Yes, you have noted shared. So, all right. Yes, it is
So
coming. It is coming.
I am sharing. Am I audible?
Now we can see.
Audible.
Should I
You are
proceed?
audible. Yeah, only half the screen is out.
So if will this is okay, I think.
It is okay, sir.
It is okay. So here is, sir, the repertorial chart of that case. and you can see the all 4 rubrics are there, and 2 medicines were coming at that time. The first medicine was Lycopodium, and the second one was Nettermure. But Nettermure was not covering the 4th symptom. Moreover, she was very mild and affectionate cow, and so I decided to go with the Lycopodium. On follow-up after 7 days, she was fine. It was the owner came to me regularly for her own medicine and keep telling that the cow never suffered from the complaint again. Now it is almost 6 months when she was given Lycopodium 1 dose, and she recovered completely with that complaint. So here, most of the time, we found Lycopodium a thirstless medicine, but from this case, even I came to know that Lycopodium do come under this rubric, that there is thirst for large quantity of water. So this was the first case where the mind symptoms were taken, physical symptoms were taken, overall case was taken, and it was cured 100% with the help of single medicine, single dose, that was Lycopodium 200. So this is the first case which I am sharing, where the appropriate rubrics, the appropriate minimum solved the case. So now I'm going on to share the another case, which is a case of dog which is having a large tumor in his eye, right eye. So there was a tumor in his right eye. A video was sent to me by her owner. So what initially was seen, that there was a protrusion of eyeball was coming out. So I will share the pics of related case first. So this was the first pic which was sent to me. Look at the right eye of the dog. There is a protruding eye, and he was asked, her owner was asked to go for the surgical removal, but they didn't perform surgery because of the summer season, and they told them to wait for 3-4 months. So I'm sharing the rest of the pics of this case. Am I audible?
Yes, sir, you are audible, and
So
we can see the
this
pictures.
is the pic of same dog, and this is a close view where you can feel and see the exact pathological changes. I will share now the another pic of the same case, so that there should be a proper understanding. So this is another pic from different angle. So this was the case.
Doctor, please unmute, doctor. Dr. Rohith, please unmute. You are muted now.
Doctor, you are muted now. Please unmute.
Am I audible now?
Okay, you are audible.
Okay. So I searched in synthesis repertory. I followed appropriate rubric under section I. The rubric was eye, tumor, eyeball behind, accompanied by exophthalmos. And the author for this particular rubric was Dr. S.R. Phatak. So I further studied clinical repertory by Dr. S.R. Phatak sir and found appropriate rubric on page number 131. And the rubric was eye protruding, tumor behind eye ball from. I again repeat, eye protruding, tumor behind eyeball from. So in both the repertories, the author was same and the medicine which was given to this case was Thuja occidentalis 200, 1 dose. I will share now the pics after just 6 days. On 6th days, on 7th day, I got the video of this case. On the 6th day, these were the pics. Again, I'm sharing the second pic. There was no tumor. Absolutely, it was fine. So I will now share the repertorial chart for this. And this was the rubric that eye, tumors, eyeball behind, accompanied by exophthalmos. And Thuja occidentalis was the only medicine. I gave Thuja 201 dose to him and he recovered completely in just 7 days. This was a miracle for me. And this case was 100% solved with appropriate medicine with the help of homeopathic repertory. So this was the second case. Now I will go with the third case, which is again a case of dog. And let me share the details of this case with all of you. So this is a case of, this is another case, which is a case of dog whose name is Jugnu. He had tumor on his nose, as you are watching on your screen. He's an adopted street dog whose owner approached me and sent me his video. Again, after repertorization, I found appropriate simillimum. I would like to share the different screenshot I have taken from my video. So this was the first pic, and after giving the medicine, before this was the first pic. This was the first pic sent to me. You can see a large growth cystic tumor on his face. So after giving there was a rubric, I would like to send after 1 week. So this was this picture was taken after 1 week. So rubric was taken face tumor, cystic tumor by me at that time. So I would like to share the rest of the follow-up of this case. So this was the first week, and now this was taken on another time. And this was taken after the cure was there to that dog. So here Thuja 200 was given as the rubric. I had already told the rubric was face tumor, cystic tumor, and it is in synthesis repertory, and Thuja 200 one dose was given, followed by acid nitricum 30 single dose every week for 3 weeks. For the total 3 doses of acid nitricum were given along with Thuja 200. After 1.5 months, the medicine was stopped and the treatment was started about on 10th of April 2023 and stopped on 25th of May 2023, and I got his last video in June, around 10th of June, and till date he is completely fine. There is no problem and no reoccurrence. So this was the third clinical case where I found that homeopathy is a very good science and it can help us in veterinary cases too. So now I will proceed with another case whose video is not available with me, but I would like to share the another case. One day a colony person told me about this dog. I went to the place and noticed an abnormal gait and weak left lower extremities. So at that time I'd taken 3 rubrics. That was the first rubric was extremities paralysis approaching gradually. Second was extremities paralysis progressive. And third was general paralysis side left. And in that case, she was given causticum 200 single dose and recovered completely within a month. So these were few clinical cases where I found the role of homeopathy, especially in veterinary cases. So now I will share another case where I found again the repertory very useful. So this is the case of this is the case. So it was a case of lactating mother. She has delivered babies, and due to malnutrition and due to his lactation, I can say that she was very weak, as you can see in the first pic. So again, here I tried the role of repertory. So I would like to share now the few pics of the similar case. So initially, I have only, so this was the first pic which was sent to me, and after the treatment of 10 days, just 10 days, you can see the changes. This is a big picture. You can see there the changes are very prominent. So again, here I have taken the help of repertory under chest. And I found that milk decreased. Second rubric, I have taken milk disappearing. And third, from journal, that is malnutrition. So 3 rubrics were taken for this case. And after repertorization, I came up with 2 medicines. These were causticum and alpha-alpha, and one more drug, sabil-saraluta. So malnutrition was there because of insufficient food intake due to high energy expenditure, and demands of lactation was there. So we provide food to that female dog along with the alpha-alpha, which we usually give in mother tincture. But I tried, and I have given the alpha-alpha in 30 potency for 10 days, regular 1 dose daily, single dose daily. So this was the another case where I found that just after 10 days, she recovered completely from her malnutritive symptoms. So this was the case where I have found that role of homeopathy has given me sufficient results. So now I would like to ask if anyone has any question or anything you people want to ask from me. I have few other cases too, but I would like to ask if someone is willing to ask any question, or should I move ahead?
Yeah, sir. It was very nice and very informative presentations today. The last one was very amazing. recovery, because within 10 days, such a cure is, we cannot imagine such wonderful things. So, doctor, now the time is extended for 15 minutes also. So you can do your talk for 15 minutes more.
Sir, these all were cases were repertorized, and proper repertory was used, and appropriate rubrics were used in cases of dogs, cows, and lactating mother. One case. I have a few other cases where our simple medicines performed very well. So I will share a simple case. So you
You are
can.
muted. Okay.
So there is a case. I would like to say that actually video follow-up are not accessible to Zoom, I think. So I am sharing this pic just to tell you that this is my Facebook page where I have uploaded all the videos of the related case which I am telling you today, and I have all the video follow-ups, and video follow-ups are not accessible on Zoom. So this is the page where I have all the video follow-ups of concerned cases. So now I would like to share the another case where I have not used repertory, but I have used my own gut feeling and my own experiences. So this is the case. So it's a full video is not available here, which is about 1 to 1.5 minutes, which is available on this page or in my gallery. But as video is not accessible on this platform, so I'm sending the screenshot of this case. Look at the wound, look at the condition of that case. So that case was on the holiday of Gurpurab, that is 7th of November. So this case, one gentleman was holding the dog. I found the dog in a miserable condition. I stopped there and asked that what is the matter. He told me there was such a foul smell from that wound that it was not possible for anyone to stand there. But I assured him that definitely I will try to help you out. So after, I will send another pic of the same case. This was the condition of neck of that case. You can see that how miserable condition the dog was having. There were holes inside his neck, and it was a very miserable condition. So now I will share the another pics. So look at the neck now, which recovered completely. It's same dog. There was no wound. Even the all hairs were come back, and the wound recovered completely. And this was the place where the wound was there, and now I have my hand over that wound that was completely cured. I'm extremely sorry that I can't share the video of this case that is about of 1 minute, but this is available on this page. Please do and watch. But this case was solved there. I used the medicine, single medicine I have used, that was pyrogenum 200. I think the only pyrogenum 200 and later pyrogenum 1M was given to resolve the case completely. So it take about 1.5 months to resolve this case. But till date, I used to travel on that way, and I found this dog is completely fine. There is no scar, no wound, no reoccurrence. So this is the beauty of homeopathy. Here I would like to thank that person too, who sincerely gave the medicines to that dog, which I provide to him. So this was the case of pyrogenum 200 followed by 1M. So here I would like to share one last case. That is the case of, again, my initial days. And that was the case of a kitten. This was the case. So look at the eyes of that case. Even she was not able to walk properly. They told me that she is blind. But when I look at her, I found that she might be having some infection in the eyes or having some problem. They told me that they have sent this kitten to angio, recovered completely. Now again, she suffered from the same infection. Moreover, again, I tried to share. Now I'm sharing the another pics of same case, that she was having infection. So this was the condition. She was not able to see, she was not able to move properly, and she was in a very miserable condition. I found her in a temple which is near to my home. So here again, I have not repertorized, and I don't feel, and I would say, the grace of God, simple our medicine sulfur. I'm very much obliged to homeopathy and sulfur too. And here it was my starting to treat the veterinary cases was sulfur 200 cured this case just within 3 days. Again, it was a single dose. I had given them 2 doses, but they have um, by chance one dose was uh, discarded. So single dose was given to this case. And I would like to share now the follow-up of this case. Please be with me. I'm sharing. So this is the follow-up that case. You can look at the eyes, look at the forehead of this kitten. There is no infection. All the infection recovered completely, and she was able to move in right direction. Earlier, she was not able to see, and she was not able to move. If she moved, she used to stuck here and there. So this was the case of sulfur 200, again, the single dose. Whatever I had shared today, all the cases have 1 or 2 doses. They were not given TDS. They were not given any medicine for a long time. Another a simple case hai. Again, this is a simple case of sulfur. He was given sulfur 200, recovered completely within few days. So these are all our cases with me where I have follow-ups before and after. Unfortunately, I'm not able to share the video follow-ups as they all are there in my mobile, but this Zoom is not accessible for video follow-ups, which are all are available on this my page Homeopathy and Health, which I have created for awareness about homeopathy, awareness to my young colleagues, to my colleagues, to my fellow doctors, to share my experiences or to learn more from my seniors about the utility of homeopathy, homeopathic repertory in veterinary cases. So this is if anyone, any of you, my dear fellow, want to see the video follow-ups, I have uploaded all the video follow-ups and concerned cases on this page. You can go for it. So now I would like to ask if anybody sincerely want to ask me any question or anything related to homeopathy. So it would be my pleasure to answer that question.
Thank you, sir. Thank you. Such a wonderful presentation. Now, I invite Dr. Ramadevi Ambadi to raise your hand.
Can you hear me?
Yeah, we can hear.
Really mind-blowing were your cases, my dear son. Really mind-blowing. See, I am a pet lover. I have got one dog. She has got a severe itching. We have tried so many medicines. I will send you the video of my that dog.
On this platform, I would like to admit one more thing, that I used to treat every animal at no cost, whatever be the part of the country, and I have the page on Facebook, and you can note my phone number, that is 9888 301 408.
9888
Again, I will repeat,
301 408.
9888 301 408.
Okay.
So you can ask any question, any remedy. It would be my pleasure to help any animal case.
Really, you are blessed, my dear. See, you can very well tell that your life was not in vain. Really, you will tell, because all we people are giving medicine, using homeopathy for what I should tell, for satisfaction, of course, but we are getting money. But in your case, you are treating them without expecting anything from them, free of cost. Really wonderful, really blessed.
Because, ma'am, according to me, the animals genuinely, they don't know that they have to pay for medical services. I think so.
Really, sir.
So,
really, I could not tell anything. I feel no. I feel
so I
crying.
feel my gratitude to, at least we can give the quality treatment to them.
Sure.
Please share your number in the chat box, doctor.
Yeah, it is
Okay, I
written
will send my pet's photo.
So,
okay, I will keep in touch with you, doctor.
This is ma'am. This is my page where the phone number is given, cases are given, and I will be very happy that I will be happy to solve your case. This is the page. Here I have all the numbers and I have all the cases too. So if anybody want to ask or guide me that about the role of homeopathy in veterinary cases, so it would be my pleasure.
Okay, my doctor.
Thank you, doctor. Now on asking whether which medicine you used in the last case.
Sorry?
Which medicine you used in the last case? I think that the cat.
Which one, sir?
Last one, the cat. I think that the cat
Cat,
bleeding.
sir, that was simple sulfur, sir. Sulfur 200 single dose. So no repertory analysis was done. It was just for my gut feeling that case of pyrogen and sulfur.
For the second case, that dog.
Second case, ma'am, which has a tumor on eye.
Yeah.
Yes, ma'am. That case was given Thuja occidentalis.
I think that's
Thuja was given to that case, but I would like to share the. You would like to share the. That was the rubric that solved the case was eye tumor.
behind
bar
whiteboard. I know.
Accompanied
Patak.
by exophthalmos. That was in synthesis repertory. When I studied and found that it was
Patak. This
author was Patak. So I studied again the Patak repertory, and the similar medicine was there on page number 131.
Okay.
So again, Thuja has given marvelous results, and I was happy that at least I had done the authentic work according to repertory. So I'm trying to reach repertory in each and every case wherever possible.
Okay. If I am coming to your place, definitely I will see you in person.
Sure, ma'am. Sure.
No, doctor, because most of the cases in veterinary doctors, they are charging a large sum of money in cases while they are treating. So you are doing a wonderful job. So anybody want to ask any question? Share your experience. Most of the cases, I have seen that most of the cases they are using surgical methods, and these which are the cases you shown, and most of them are they are doing surgery, and it is they are making money, a large sum of money, because they know the attitude of the people, those who are the lovers of pets. So now,
Sir, again, I will say that the animals, I think they don't know that they have to pay for medical services. And nowadays, people are using so much combinations, patents to increase the milk in cows and buffaloes. So it was, it's painful to me that why to torture them for increased milk production. So they are giving high doses of antibiotics for if they got infections to their breasts. So there are a number of cases, sir, where they have seen that blood comes through their breasts while they get milk. So it's my sincere approach that every animal, especially the animals which are in street, who wander in the street, people who left them. So I have number of cases where I don't have video follow-ups, but I have given them medicines here, and they recovered well. Some of them I never met them again, but they got treatment from me.
thank you, sir.
So
Now, Dr. Hariharan want to ask you.
yes, sir.
Okay, doctor, we are proud of you. First of all, I'm thanking you. Hahnemann proved the medicines on human beings, and we are treating the animals and plants. That one thing is sure, that vital force which is animating human beings, animals, and plants, these are one and same. This is the principle.
Exactly,
So,
sir. Exactly, sir. Even that the second case where the tumor was an eyeball, that that might be proved or the clinical observation on a human being, but that worked too well in a case of a dog. It was a miracle, and it was quite astonished feeling for me at that time that a proved symptom of men, a human being, worked very well in a case of animal.
Doctor, that is what I said. Is the vital force is same in human beings and the animals and the plants. The vital force are same. Vital force is same, not are, but is same. So that it is acting well.
Thank you,
No
sir.
doubt in that. That is what I said.
Yes, exactly. You said the same, sir.
Oh, that is what I said.
Yes,
it is the
yes,
same vital force. It is the same vital force.
yes.
So these medicines acted very well in animals also.
Yes,
No need
definitely,
of
sir.
proving. No need of proving in animals.
Yes,
That is the wonderful truth behind it.
exactly,
These
sir.
are all clinically proved. Here, one Mustafa sir is there, one veterinary doctor. He is using so many cases he proved and he healed, and 250 videos he is having. So, in such cases, we can say that Google says that homeopathy is a pseudo medicine or pseudo. So,
Pseudoscience.
pseudoscience, yeah. They are saying that pseudoscience, but you are proving, because these cases are all clinically proved. Most of the doctors having treating so much cases, but we have to make videos in the YouTube and upload the YouTube. Then it will be now or sometimes later. It may many people will watch and they want to know how they are healing and they will go to homeopathy. That is a great thing you did, but you are not even charging the patients, charging them. So we are all happy. Such a personality like you always like to share your knowledge and share your money and share your time for to do all this wonderful thing. So anybody want to ask? So now 5 minutes more. If anybody want to ask any doubts to the doctor?
Why
Yeah.
you gave urgent nitricum? That I do not understand. One case you gave Tuja and along with you gave urgent nitricum.
Sir, it was not argentum nitricum. It was nitric acid, sir.
You said
Acid
I think
nitric.
I heard it is urgent
I
nitricum.
used the nitric acid as the thuja was antipsychotic and was the appropriate simillimum, and nitric acid as an antisyphilitic drug, and that
Okay.
growth was very fleshy, and uh, uh, what I felt that growth is somewhere might be on touch, it might bleed. Moreover, sir, in this case, the chemotherapy was started, but dog was not able to. Dog was not compatible with the chemotherapy, and he started getting down. So uh, the case. So one session of chemotherapy was given, but they stopped that treatment, and the dog was very low. After that, they called me. So here Thuja was given, and one antisyphilitic drug, nitric acid, was given 3 doses, which was my gut feeling. And there was a rubric too, that was nose warts, no zone. So this growth, definitely this is a tumor, but that 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 rubric was carrying that rubric was nose warts, and on this in this rubric causticum, nitric acid, and thuja was there. Causticum and thuja was in 3 grade, and while nitric acid was in 2nd grade. So it was my gut feeling. Uh, So nitric acid, 3 doses were given at that time. That was not argentum nitricum. Nitric acid was given, sir.
Okay, very correct. Now I
For that
understand. Now I
for
understand.
that undernourished cow, sorry, dog, what did you give? Alfalfa in potentized form.
Because alfalfa, most of the time we used to give in mother tincture, and the dog, in my
I know. We could not give them alfalfa martinger. They will not take.
No, that was alfalfa 30 potency. Charged
30
tablets.
Doctor,
Please,
how you are administering these medicines? How, which way? Somebody is disturbing. Somebody is. Doctor, the way you.
Please unmute. Please unmute.
Aryan sir, you can say vote of thanks also. Now the timing.
No, sir. No, sir. I would like to comment one thing.
Yeah.
Just before. I shall say vote of thanks.
Okay. Doctor, how you are, which way you are administering these medicines? I like to know. Can you hear me, doctor? No. Hello?
Dr.
Rohith Sharma.
Yes, doctor, you can ask your question.
Hello, doctor. Which way you are administering the medicine? Which way of administration? Or you are spraying, or you are by mouth, and which way you are administering these medicines? Let me know.
Doctor, please unmute, doctor. Please unmute. Doctor, please unmute. You are muted. You are muted. Please unmute.
Okay. Am I audible now?
Yes,
Thanks, Danish sir, for encouraging me, for boosting me to perform today.
Okay, doctor. Doctor, can you hear my question?
Yes, sir. I'm coming to your point, sir. Sir, this is basically very, very, very genuine question, which I would like to answer. Sir, most of the time in the starting, I failed to give remedies as I used to put drops on bread for cows, dogs. So they never take the medicine because due to alcoholic smell. So again, I take the green grass. I used to put some alcohol. So even then they used to left because the smell of alcohol, they don't like alcoholic smell. So I use the method that there is dough from which we make chapatis. So I used to make a hole with my finger in that, and then I put few globules of medicated medicine. For example, if I met a street street cow, so I used to put in the dough from which we make chapatis. So cow, buffalo, they used to take medicine in this way, in a very good way.
Okay.
Similarly, sir, in case of dogs, even they don't, they left if they smell our alcoholic medicine. So I used to give medicine them in milk. I used to dissolve few pills of medicated medicine in milk, and dog never left the milk. So there is always a chance that your medicine will go in the right way.
Okay,
Similarly, sir, I have not shared today the cases of pigeons. So in case of pigeons, neither you can use any of these ways. So I put direct drop by opening their mouth and direct add medicines to them. So till date, I have treated pigeons, cow, buffalo, dogs, cats, and rabbit once. So this is all about that. It is the easiest way that what food the animals like. If we'll mix and match or we'll do another way, so there will be a problem.
Thank you, sir. Now the time for to go our
Okay.
next
Okay,
session. Now I invite
okay,
Dr.
Doctor,
to say order.
Dr.
So I
Rohith,
would like to thank
Dr.
all of
Rohith.
you so for listening me, and I really appreciate the effort of this form.
Okay,
Dr.
doctor.
Dr.
You are-
Rohit, it's really a very good presentation from you, and we hope you can also come out here and make some more presentation. And tomorrow we will have another veterinary doctor directly coming in this forum, and because he is an experienced person, he's using only homeopathic medicine for this veterinary field, and he is none other than Dr. Mustafa. He is a veterinary surgeon also. He is practicing homeopathy for the last 20 years and doing wonderful results. So please join tomorrow. At the same time, he will be presenting some of his wonderful cases here. So you can have a chat with him, and I shall share his number to you also, so that you can communicate whenever you get a doubt of such things. So this is with that, I would like to thank you on behalf of International Forum for Promoting Homeopathy, as well as on my behalf. Thank you, Doctor,
Thank you.
and good
Thanks
night.
a lot, sir. Thank you to all of you.
Thanks a lot, Dr. Rohit. And now I invite Dr. Shaila for the next session, Malayalam session. Thank you. Thank you all.
Thank
We
you,
are
sir.
concluding our session.